Hello everyone, my name is Sam LaChance from paramediclab.com, and today I'm going to be doing some drug calculations. This is my first video, so this is a bit of a test run, but I've gotten a little bit of feedback saying that math is certainly a challenge for a lot of students, so I'm going to go ahead and go over a few questions and see if we can make this a little less painful. The book I'm using to get these questions out of is called Pharmacology for the Pre-Hospital Professional, and this is by Dr. Jeffrey Guy. And this is an excellent resource. Not only does it have a bunch of drug calculations with scenarios and very helpful, useful things that actually make these calculations seem more relevant, but it also has information about every single drug, pictures of the drug, great explanations. I absolutely adore Dr. Jeffrey Guy. He's brilliant, and he also, as a matter of fact, does a podcast that accompanies this, where he explains everything in depth and kind of uses some anecdotes of his experiences and things like that. And he also does a podcast called ICU Rounds, which is a little more advanced. It basically follows him in the burn unit of Vanderbilt, and he talks about certain cases that he sees and so on and so forth. But anyway, long story short, this is a great book, and I will be taking the example out of this. You can probably find this on Amazon.com. I think that's where I got mine. Okay, so let me get organized right here. This is a scenario from page 77, if you happen to have the book. All right. Titled Symptomatic Bradycardia. You respond to a law firm office for a 55-year-old woman with mild chest pain, dizziness, and shortness of breath that began after she returned from lunch. She is pale, cool, and moist to the touch, but is oriented to person, place, time, and event. After beginning your supportive care, you find that the cardiac monitor shows a sinus bradycardia, and her vital signs are as follows: blood pressure of 84/50 millimeters of mercury, pulse of 50 beats a minute, respirations of 20 breaths a minute, and lung sounds are clear. You consider immediate transport, but the building's electric power is out because of snowstorm, and the elevators are not functioning. You decide to attempt to stabilize on scene. After administering the maximum doses of atropine without change, and without response to transcutaneous pacemaker, TCP, that you applied when the patient's heart rate did not improve with the atropine, you are advised by medical direction to initiate dopamine infusion at 4 micrograms per kilogram per minute. The patient is 110 pounds, and you're using a standard mix of atropine. All right. Now, when working out these word problems, something that I find helpful is just get all the information out onto the paper. When there's a lot of variables, no matter how good at math you are, it's very simple to mix up. So at the top and right, dopamine. And we're going to go ahead and start with the order. The physician has ordered 4 mics, or 4 micrograms, per minute, per kilogram. Alright, next is the weight. Patient weighs 110 pounds. But since our order says kilograms, we're going to go ahead and do the conversion right now. The conversion from pounds to kilograms is dividing the pounds by 2.2. And so this happens to equals 50 kilos. And next is for the mix. The mix is standard. And the standard mix of dopamine is 400 milligrams in 250 milliliters of solution. Okay. Now here's the formula we're going to use. I happen to do a different way, but right now I'm going to teach the way that our instructor is teaching, just because it's nice to have the uniformity in class. And there's 100 different ways to do every math problem, so if you happen to pick up my way of doing it, or just find your own way, as long as the answer is coming out to the same as he's getting in class, it really doesn't matter. That's the beauty of math. There's 100 different ways to do just about anything. Okay. All right. So I guess let's keep that up there. The way he sets up the formula is as follows. So you have your order times your weight in kilograms times 60. And you may ask, why are we using 60? Well, we're using 60 because we want our final result to be in milliliters, so the amount of fluid you're giving per hour. And with drugs like dopamine, you're typically going to do milliliters per hour, or a unit of volume per hour, because you're going to be using a pump. With something like this, where it's so potent and you need to get an exact figure, it's probably not wise to use a drip set. Although you can, it's probably best to use a pump. All of this is going to be over the concentration. And so you may ask, what is the concentration? Well, the concentration is nothing more than a simplified mix. So when you're wanting to find the concentration, what you simply want to do is figure out how many milligrams of medication are in 1 milliliter of fluid. And so how are we going to do that? Well, we're just going to divide. It should come out to a relatively clean number, since the numerator is larger than the denominator. It should come out to anything above 1, that is. This happens to be 1.6, nice and clean. And that's milligrams per milliliter. So let's use 1.6. Well, I guess I should have written concentration down there, but we'll do 1.6. And we'll set up the rest of it right here. So we have our order of 4 micrograms per, our weight is 50, per minute, with 60 minutes in an hour, all over 1.6. Now you may notice that this 1.6 is milligrams and not micrograms. Of course, we want to get our drug calculations right, or else we have the tendency to kill patients. So we're going to go ahead and convert. We know that 1 milligram has 1,000 micrograms. So in order to convert this milligram to micrograms, we're simply going to multiply by 1,000. So rewrite the equation. All over 1,600. And that's really the beauty about this equation. I think that this is the reason why our instructor chose it, is because it's simple plug and chug. Now, if you're used to doing algebra a certain way, or have been taught a different way in school, then that's fine. You can piece your way through it and just kind of problem solve as you go, which happens to be the way I do it. But this is nice because you just get to plug and chug, and it's nothing that's too complicated, okay? All right. So, here we go. I'm going to get a new sheet of paper. So let's set this up again just for the simplicity of it. Got a 4 times 50 times 60, all over 1,600. Okay? So let's go ahead and get rid of the numerator first. Well, not get rid of, but let's go ahead and simplify the numerator. Okay? Now, since I have my handy dandy calculator, I'm going to go ahead and plug in 4 times 50 times 60. And that gives me 12,000. So let's go ahead and write that. 12,000 over 1,600. Okay? And this is going to give our answer in milliliters per hour. So if we go ahead and do that simple division, we have our 1,200 right here divided by 1,600. And you get 7.5. Simple as that. All right. I'm not sure if there's a place in this book to check answers. There should be. But take it from me, you got it right. So that's how you do this certain dopamine problem. I'll probably release some more videos here in a little bit. I hope this was helpful. I'm also going to start releasing some videos of how I do it here in a little bit. I'll probably go ahead and get through a lot of problems the way our instructor does it, just so you can get a sense of how he thinks it supposed to be done. But it's certainly not bad to know a lot of different ways. Okay. Well, thank you for your time. I hope it helps.